I'm Mackenzie, and I'm going to be teaching about geriatric hypertension today. So, the occurrence of hypertension in the geriatric population is higher than that of the adult population. Between the ages of 55 and 65, approximately 90% of the people have a risk of developing hypertension in their lifetime. The most common type of hypertension in the geriatric population is isolated systolic hypertension, or ISH, and this is when the systolic pressure is greater than 140 and the diastolic pressure is less than 90. But it is important that we control the systolic blood pressure because it can cause a stroke, heart attack, or a heart disease. So as people age, your body goes under a lot of changes that can contribute to hypertension, and we're just going to go through a few of them. So increased collagen and stiffening of the myocardium. So the heart is not working as efficiently to pump blood out and get blood to the rest of the body. Loss of elasticity in the arteries caused by atherosclerosis. So atherosclerosis is the buildup of plaque on the arterial walls. And loss of elasticity results in the heart having to work harder to push it through the blood vessels. Decreased adrenergic receptor sensitivity, and adrenergic receptors we know are what are important when we give blood pressure medications like beta blockers. Like these receptors are where those medications primarily work. Increased peripheral vascular resistance. This makes the heart work harder and put more pressure on the vessel walls, causing hypertension. Decreased renal function. So the kidneys play a very important role in controlling somebody's blood pressure. So when the kidneys are not working as well, then somebody's blood pressure is not going to be controlled as it should be. Decrease in renin response to sodium and dehydration. This also goes back to kidney function and the RAS system, and the RAS system plays a very important role in controlling people's blood pressures, but the RAS system can be a whole other topic. Medications, considerations, and managing medication therapy. So when a person gets older, a lot of their bodily functions start to slow down. And when we need to take that in consideration when we are giving them medication, because maybe that medication is going to be staying in them longer and it's not going to be excreted as fast because their kidneys are slowed or they're not working as well as they should. For a geriatric patient who's on blood pressure medication, the absorption time is slower because there's decreased blood flow to the stomach and the gastrointestinal tract, or the GI tract. And their metabolism is slow, so they break down that medication a lot slower than the normal adult. The first drugs of choice when treating hypertension in the geriatric population are thiazide diuretics, calcium channel blockers, and ACE inhibitors. What is important to educate your patient when they are on antihypertensives? And the answer is they need to be educated to stay on them slowly, because these medications, especially with diuretics, can experience orthostatic hypertension because of the quickly shifting fluids or the loss of fluid in the body. What are some other things that you need to monitor for while older adults are on diuretics to manage their blood pressure? Well, with the loss of fluid in their body, as nurses, we need to monitor for dehydration and electrolyte imbalance. Electrolyte imbalance is very important because electrolytes control your heart function, and we don't want to have more issues with the heart than we are already having with their hypertension. Older adults can also have a higher sensitivity to the medications, so it's important that we watch for any significant side effects or adverse effects in our patients. And they can sometimes receive a lower dose of medication than that of an adult patient, but ultimately that's up to the provider. So some modifiable risk factors that contribute to hypertension and that an individual can change. So the patient can change their diet first of all, And the DASH diet helps manage blood pressure. And this just helps reduce the amount of sodium in somebody's diet. So as we all know that sodium follows water and water follows sodium. So if somebody has increased sodium in their body, then they're going to have more fluid in their body, which can put more pressure in their blood vessels because of the increased blood volume. They also need to increase their activity time. And there's a significant change in somebody's blood pressure within 8 weeks of being on a DASH diet. And there are specific serving sizes for certain food groups that a person would follow while they're on this diet. And this can be found on page 418 in the Medical Surgical 5th edition textbook. Thank you.